hello to our guest, which is Vincent Zimmer from ICME Healthcare. He's the managing director of the Invest in Shareholders, I believe. And Vincent, where are you tuning in from? You can say hi to our...
Hello, everyone. Yeah, I'm tuning in from my home office in Berlin. You can see, like everyone else, I stay at home since I think almost 3 weeks now. And yeah, thanks for having me today.
Vincent, how about you tell us a little bit, you're a serial entrepreneur. How about you tell us about who you are and what you've done in the past and how you've therefore ended at ICME Healthcare, and then we can talk about the rest after a nice little intro.
Great. Yeah, thanks, first of all. I'm from a medical family, so all of them are medical doctors except me, so I'm the black sheep, if you would like to say so. But I started off, I think, as an entrepreneur already in 2008. I built around 5 companies in my life. Besides my studies, I'm a trained economist. I started a PhD in psychology, for example. But my passion always has been around entrepreneurship. I founded companies between Shanghai and Sao Paulo, so it was quite internationally. I lived in Turkey, London, Denmark, and came back to Germany in 2015. Actually, then around the refugee crisis, together with my co-founders, I built up Kiron, Open Higher Education, which is an online university focusing on refugees. So it always, have a red line with all these ventures was always, I like complex problems and let's say holistic solutions. So I'm rather focusing on how to solve societal challenges, or how to achieve system change rather than how to buy cheap shoes and sell them more expensive. After Kiron, which was a tremendous experience, has grown into an educational platform for around 7,000 students. I moved on to Ada Health because I felt like digital health, resonates very much with my family, and I was very interested in the space. Spent some time there, helped building up the business development, and then moved on with that learnings to ICME. ICME is a quite interesting player because it is a quite old, or established, old is maybe not the right word, established is a better word, management consultancy. It was founded in 1954 in Swiss. Main offices are in Germany and in the MENA region. And the interesting part is that we do not only consultancy for governments, but also do implementation. Traditionally, very strong focus on hospital sector, but now with my entrance, basically more and more also focusing on digital health. And that is quite rare, that you have this combination of looking at, established structures and how to move and change them, and at the same time bringing innovations, doesn't matter if they're not digital or not. And this is something what I was looking for, because I felt in my life I came very often to this glass ceiling of, we have innovations that grown into a lighthouse project or a pilot, but then it doesn't get any further than that. And I think also the title of our course is quite well. There are many great ideas out there to flatten the curve, but how do you achieve real impact? And this is what drives me.
And just quickly, background for ICME, it's a Swiss company, is that correct?
It's it's a little complex. We have like around 7 daughter companies, and it's like a complex holding structure. The holding company is in Swiss. The main healthcare company is based in Hamburg. We have a Berlin office, and we have offices in Abu Dhabi, for example, but also in Kosovo and in other regions. Yeah.
Okay,
but I think it's fair to say that we are a German company.
Okay. So you have a heavy influence as to the German market and the European market. Like, what would you say would your reach be in terms of when you're looking at solving certain healthcare issues?
So I think our network is definitely focused on Middle and East Europe and the MENA region, with strong ties as well to the US. So we have made, for example, also direct investments, especially also in ventures in the US, in Finland, but also in UAE or in Egypt. We have less ties to, let's say, Asia, for example, and we have been part of quite a lot of development projects, especially in Ethiopia and when it comes down to Africa. But this is something that is developing at the moment.
Okay, and as to your role, what is the exact everyday work of your role look like as a invest and share, like the managing director of that part share and shareholders and investors? That's
So
what
I
we
think
want.
one important part about us is we are not a digital startup, let's say, and we are also not an industry player. So we are owned by four partners, which I'm one of. That is the shareholder part. So we are a neutral, independent actor in the field. And as managing director of ICME Invest, I actually oversaw the ramp up of our fund with a capacity of around 500 million, which was aiming at especially financing hospital projects and digital health projects. And I'm overseeing basically development around this fund, our direct investment activities, but also then our cooperations with digital ventures. So what we try to do a lot is how to bring different actors together, basically to achieve, solving a problem. And this is more often rather done by bringing the right people together and helping them to learn the right things rather than just by providing money.
And I believe since you guys have existed since 1945, it's a rather old, you have been around traditionally for a long time. So it probably reflects your network, and that's how you're able to maybe create a lot of impact.
I think that's why I joined. That is the interesting part. You have people from the industry. So, for example, our CEO and chairman on the mother company has spent quite a decade with Dräger, for example, or Professor Dr. Surutoma, our medical partner, has had extensive knowledge and experience in the research field before he joined ICME. So we have this combination of a established network and quite old relations also to the government. But at the same time, my team, for example, is quite young and they're coming more dominantly from the startup sector.
Okay, so now I think we have a little bit of background knowledge. We can now go into the nitty gritty of, as our title also says, the real curve flattening. How did you guys experience the oncoming of Corona? And maybe, I don't know if you have a timeline, because my feeling is you guys saw alert signs maybe much earlier than the rest.
Yeah, I think the knowing about things and understanding them emotionally goes here a little bit not hand in hand, if you would like to say so. So indeed, we had the first warnings already in January. We were in Dubai at Arab Health, and basically our colleagues were returning from Shanghai because they were sending home from projects or being sent home from projects because of the Corona outbreak. And there it was already clear what will hit us later on. But personally speaking, I have to say it was for me a little bit like the Trump and the Brexit occasion. So I understood it, that this is a thing, but emotionally I wasn't prepared for what we were getting into. And I think this is the reason why we have been able to react so quickly. On the other hand, is because we have been developing those solutions and these connections quite a long time already beforehand. So when the Corona crisis hit Germany, it was pretty clear, okay, what you need to do is ramp up testing capacity, but it doesn't make any sense to, because we understand how hospitals work, how the healthcare system works, how Meldevorgänge, the way the reporting basically works in the official systems and the way our systems are interlinked. It was pretty clear that we need to find a digital solution that is at the same time scalable and very much focused on the people being affected by Corona, and to not, shoot 100 tests and then you run them with the 100 wrong people, basically. So this is where we started off that we had a pretty good understanding from the beginning what wouldn't work. It was a little bit funny because I mentioned the background from Holger with Dräger. Dräger is the main producer of this air supporting machines, for example. So he knows pretty well what the problem will be there. For example, also that if you provide more machines, the training of the staff takes quite some long time. It's not like we're missing just the medical devices or just the intensified bed care. It is really a complex problem that you can't solve overnight. And yeah, maybe.
I was just going to say, could you go back a little bit and maybe talk about the initial products that you already had, where you said, oh, okay, this is the product that we can now use in terms of the solution? Because then it seems like you were able to ideate on the solution, so it's fitting. Maybe you can give us a little bit more background on what you guys already had that was existing.
So I think also given my previous background in the field of symptom checking, I had a quite well understanding of how symptom checkers and AI-driven solutions could apply to help diagnose people faster, accurate, and on scale. I think that was pretty helpful. And at the same time, we also understood how this alone isn't a solution. That, you know, what do you do then when you have a better understanding if you have the symptoms or not? And also that with Corona, you have certain people don't have the symptoms, so you have to include certain risk factors on top. Another project we had before was around lab tests. So how do you assign the right lab test to a previous person? Based on what criteria, and how do you drive an e-commerce or a digital funnel to that? So this was ways we established before, and now the thing we had to do is bring these two sides together and include a telehealth option. We started off pretty quickly with teleclinic, and we designed the whole process as, you know, we want to help. So this can't be an initiative that is focusing on in just our partners, but it has to be open for other partners to join in, and the concept has to be so universal we can transfer it to other countries as well. And actually was among the first people who tried it out, who got a whole test kit delivered to your home. So the basic idea is that you are able to check your symptoms yourself, then have a telehealth consultation instead of going to a doctor, and then you get a test kit basically sent to your home. You can take the test sample, send it in, and get the results based on that. What we're still working on is then what comes after that. So how do you support then people with positive tests on the long run? I think there, for example, I think Hello Better is one of the partners who now recently got into initiative. They're providing psychological support. And so the whole thing exploded, right? So that's what I described earlier. We wanted to come in and not just do a thing that looks good on paper, but something that is really helping people. And then you have to consider a lot of different scenarios, a lot of different cases. So what is with people who are elderly, who can't take the test alone? What is with people who are maybe taking the test in the wrong way, so you have false negative? So how do you ensure that this is, you know, avoided to a great extent? So this is where it got complex, and I think where we also decided to join for the hackathon from VR versus virus. Not so much because we said, okay, we don't feel we can't do this alone, but we feel, oh my, the thing is more complex and we need to involve more people around it in order to be able to succeed.
Okay, so just so I get it right, it sounds like, so there's basically 3 products or 3 main aspects that you're putting into one. The one was the testing, then the symptom tracking, and the teleclinic. Is that correct?
I think it would go away from the providers, and while I speak about solutions, it's not teleclinic but telehealth option. Teleclinic was the first partner in there. It's a symptom checker, or let's say an self-learning tool that you can help understand your symptoms with, and is then indeed is the test lab provision. I think the 4th component that comes after that is remote monitoring, and the whole concept we call around smart care, so that we can also loop patients in at different aspects of the journey. So what happens with people who are, you know, going to the doctor and then being sent home and still want a test kit, because test kits are not centralized available everywhere in Germany. That's a problem, right? So at each point of the journey, you must be able to loop in as a patient without losing, you know, the ability to go back if you need to.
Okay, so how far are you guys in the implementation process? Because it sounds like is it an MVP still, or is it like, and what aspects are those can you implement right away without having to deal with, you know, government issues, policies type of things?
Pretty early on, we pitched the concept to the Ministry of Health, especially, but also the Ministry of Development. So from the beginning on, the international expansion was also quite relevant for us. From the, let's say, on the national level for a moment. So the positive thing was we are working with industry partners, right? So we have been live and rolling, like delivering on this from day one. So I think with the partner from the lab test providing side, they have been conducting around 200,000 lab tests so far.
Okay.
Quite an extensive number. Not all have been going through this process, and we had, for example, we had to prioritize lab tests coming to the hospitals, because there you have the, you know, emergency cases that must be definitely prioritized before private cases. Yet with Teleclinic, they, I think, performed around 2,000 health consultations per day. They have been still struggling to, you know, find the right financial capacities. How do you provide it for free on the long run to people? Whereas with other telehealth providers, they have the ability to build that to the GKV. So there we can have a much more scalability. So we have been delivering in different parts and aspects of the project already in different speeds, I would say. And the problem is more like, how long can we do that, right? And at which part, or how long can which partner do what, and until he reaches his capacity. And this is a challenging process now to coordinate, to turn the volume on on some people, to turn the volume down on other people. We have been holding back a little bit of public communication. So we had a first LinkedIn page of LinkedIn post, I think that went quite popular. But we also, as ICME, we said we are the coordinator, bring all this together, but this is not our solution. You know, we don't intend to make this a business for us. We started this all off because we feel it's a great showcase to see how digital solutions can help, but also how complex it is to bring them all together.
Can you give me, for example, a customer journey of how they would get involved in some of these things? Like, so for example, how would I be able to get tested? And if I wanted to do a symptom tracker, then I'm downloading an app?
It's that's I think the difficulty at the moment, that we don't have the, you know, traditionally, like, you have a very simple case, you have a patient journey, you go to it, and, you know, 1, 2, step 5, and then you're through it. In this process, you can't do that because neither the government nor any private organization will have a centralized funnel for this. So you have, for example, a number of partners listed at the Health Innovation Hub website, which is officially linked website to the health ministry. So you could say this is the official starting point. And from there, people could come to either, for example, at the symptom checker. There's actually two. There's one that is not intelligent, which is the one developed by the Charité, which is pretty good, but also serving just the standards from the WHO guidelines and, you know, basically, they say the questionnaire, the standard questionnaire medical doctors use. And you can also access the symptom checker also from that side. From there, you would go on to Teleclinic or the other telehealth providers. I can't, there are 5 more coming, which are going to be live by the mid of this week, but I don't want to drop too many names before speaking to them. But from there, you would have the telehealth consultation, and then you would be passed on basically with the address you provide in there to the lab test provider. The laboratory that is mainly conducting the tests is in Greifswald, actually, at the moment. They would then send out the test kit via German post. You get it by post. You take the sample, send it back. The results are then sent back to the doctor from Teleclinic via fax, and this is also how the linkage works back with the official Melderegister. So they would then also, if there's a positive test, announce it to the authorities, which has to be happening because otherwise we can't track the people. And positive test resulted, or positive tested patients will receive a phone call, as well as the results will be sent by post to them.
Okay, and so did I get it correctly that the tests are, you can already get a test, correct? If I wanted to. Do you know what they cost by chance? Because this is prevalent for anyone listening in from Germany that says, okay, for some reason I can't get a test, so I'm willing to, you know, pay upfront by myself. Do you happen to know a little bit?
Yeah, this is the difficulty. So also, again, like, you know, we also make that clear, we don't earn any money from the test, or don't get any shares or kickbacks or whatever. The test pricing is normally defined through the agreements from the lab test providers with the authorities. If I'm not mistaken, it is for, if you're publicly insured, it's around 65 euros. And if it's a self-paid core test kit, it's 140 euros. That seems unfair, but obviously, like, the GKV is the much more larger pool of patients, so they can have better price negotiations. And the way it works is that you normally sign up for it. You receive an invoice with the test kit that you can then hand into the insurance. The costs for the private link to Teleclinic, or if you're a private patient, is basically zero because they don't charge. They offer the service at the moment for free. If you're a GKV patient, basically they can charge it to a normal insurance company and you will not even notice that there was something charged for the telehealth, teleconsultation part. For that 140 euros, it has to say this private test purchases are only available if the emergency cases from the hospital, if the dose has been prioritized and there's capacity left. This is the case at the moment, but I'm encouraged to say, you know, that this is, of course, you know, we have, it's same with the Hamsterkäufe, right? We have to be all aware of that. We don't have endless tests available. At the moment, the capacity is still enough. And but it doesn't make sense. We had, for example, cases where companies came with, okay, we had one employee coming back from Italy. We want to test all 30 employees, even though they didn't have any contact, right? So that doesn't make sense. The whole idea is really that you have a triage with the symptom checker and with the telehealth consultation, and then focus the test kits on those who really need it.
So that sounds like those are kind of the bottleneck issues that you had mentioned earlier before, where
the bottleneck is rather that we test capacity increased from, I think, around 5,000 to 10,000 to 20,000 tests per day. But one of the initial partners we talked to was Roche Diagnostics, for example. And we were in talks with them and also our lab test partners to increase the capacity further. But of course, Roche is an international company that is helping out now everywhere in the world. So they had to also prioritize, you know, how do you deal with the inquest requests coming in from the US or from Egypt and from other places. So we can't increase the capacity much more. And that's why we have to be, you know, moving forward already carefully in the communication, and also be realistic about it, right? If it makes sense to test all the people or very targeted the ones in immediate danger, it doesn't make sense to go in the middle somewhere.
Yeah. And now, just because I have to play devil's advocate, when we talk about, you know, individuals or patients or citizens wanting to give out information or data, have you had any of these data discussions? And are there any challenges that you have encountered in terms of what kind of information do we need from people? Like,
yeah, originally we had the idea to establish a patient app within this project and to have a secure data backend there. For example, that patients can, you know, once the information is shared in this process and the lab test results, they can donate it to science, for example, to the charity. That was the idea. That failed actually not on the patient side, that failed on the capacity side, because the partners we talked to told us that they haven't been able to set this up in a short time frame. So we basically went back to, in the symptom checker, for example, not collecting any data, and in this part we don't share also data between the different patients, between the different providers, which is not super efficient, but it at least eliminates any discussion about data security. And also, if the latest providers, you know, the information is secured via a telephone call and via the official mail, so via post letter, it could be much faster. Sorry, noise. Can you still hear me? Yeah.
Yes, we can hear you.
It could be much faster if we had a digital solution there, and I think this is the remote monitoring solution we will be working on. I think we are obtaining the necessary certificates in the moment. I think it should be done by next week. So we didn't have any problems so far, but we avoided them on purpose. Yeah.
Okay, because one of the reasons that I wanted to ask for anyone who's listening in or tuning in from abroad, the German federal government has been testing, tracking phones, and maybe being able to see whether or not if someone was tested positive, if, you know, being able to connect their cell phones and devices and track that down. Do you see any problems with that yourself? And is it something that you guys have thought about implementing as well?
So what we are thinking about is basically for the remote monitoring, that if people are being sent at home or going in quarantine themselves, there are devices that can track, you know, the, I would say, Sauerstoffsättigungsgehalt.
The oxygen,
thanks.
capacity, oxygen capacity in most likely blood,
So
or
let's say there are some parameters that you could easily track at home that could tell you a lot about, once a patient is positive, you don't know if the development of the illness of corona is a heavy case or is a light case. And to track that there we're considering evaluating parameters.
okay. And so what are the goals that you have for the next 2 weeks? Because it seems like you're in the midst of coordinating all these things. What are some of your goals that you have?
I think what we hope to do at the moment is especially transferring the concept also to developing countries, especially we looked into the case of Syria, where there's almost no health system in place. We're talking to ministries on the developmental side and WHO to scale it, especially to Africa. So there's rather, transferring the concept and the idea of rather than it's now the internal stakeholder. And this is like I think the goal for the international side. For the national side, I think we're hoping to go through the process now with the hackathon via versus virus, which hopefully will bring together, a couple of initiatives working around the same topic, and hopefully provide a base of making this a sustainable project. So I think our role, was in the beginning to start it, initiate it, coordinate it, but I think we have to put it in more hands to really sustain it over the next months and maybe even years if the pandemic is going on.
It's also great for me to hear that we actually talked to Hannes Klepper from Hello Better a few weeks ago. It was just in time for when that was happening to better understand, mental health in this period. So I have also heard that they've been exponentially not only growing, but there's a big need for what they're doing. And actually, we're talking tomorrow with We versus Virus. Oh. So it's really great to see that we're able to really talk to the actors that are in the field. Is there anyone else that you would like to reach out to where you say there's some like wish stakeholders that we would like to have on board?
No, I think that's the great part, that we are quite well connected in the healthcare sector. I think what would be interesting for us is to close the round basically with the insurances, which we have been basically leaving aside for now because they're not just by nature, not by their culture, but by the rules they're following through. They're not as quick as we needed it to be. But I think on the long run, of course, they could play a crucial role in raising awareness and basically helping this thing to probably showcase also what digital solutions can be used for. Because I'm not an advocate for the digital should be first in all cases and the digital is always better. But this corona situation shows particularly where it could actually help. And I think insurance companies could play an important role in, fostering this change now.
That's a wonderful last statement. And Vincent, I want to thank you for being part of our World Changers in Tech episode today on how to really flatten the curve. And we wish you all the best in all your future endeavors and hopefully catch up with you again soon. So with that, I hope you have a wonderful Feierabend, maybe in your apartment, your living room or your balcony. So we will stay in touch and thank you again. And I hope everyone enjoy the show. And we will see you guys hopefully tomorrow at our V versus Virus with Anna from Tech for Germany. Danke, Vincent, and take care.
Thank you. Bye-bye.